Patients and families are Stoughton Hospital's #1 priority. To provide trusted health information to our patients and community, we present Stoughton Hospital Health Talk with Melanie Cole.
America is in the midst of an opioid epidemic. Consider that in 2012 alone, healthcare providers wrote 259 million prescriptions for opioid pain medication, enough for every American adult to have their own bottle of pills. To address this national health crisis, the Centers for Disease Control and Prevention issued guidelines in March 2016 urging providers to reduce opioid prescribing in favor of safe, non-drug alternatives such as physical therapy for chronic pain conditions. My guest today is Emily Devine. She's a physical therapist with Stoughton Hospital. Welcome to the show, Emily. Tell us about what's going on with this opioid epidemic that we're seeing in this country.
Thank you for having me. As you said, the epidemic is quite real, and I think the fact that 1 of 4 people receive opioid prescriptions that are for non-cancer related pain ultimately do struggle with addiction, and deaths have quadrupled with these prescription opioid prescriptions going up. So it's definitely become an issue, which is now pushing a lot of providers to look to ways of treating pain and managing pain that doesn't include a bottle of pills, like you said.
So what can a physical therapist do to help offset some of this so that maybe a patient doesn't quite need as much medication?
Sure. So physical therapy treat pain through movement, through helping patients improve strength, improve your flexibility, improving range of motion. And then we can also educate patients about pain, which has also been shown to help improve outcomes. Where opioids generally mask the sensation of pain, physical therapists treat pain through movement. Where opioids have a lot of different side effects, which many are aware of, such as depression, overdose, addiction, and then really significant withdrawal symptoms. Physical therapy side effects generally include like improved motion, increased independence with your daily life activities, decreased pain, and then ultimately even prevention of other health problems that your physical therapy may pick up on, or physical therapists may pick up on, or that just generally improve through improved movement and exercise. The effectiveness of opioids for long-term pain management is really inconclusive, where with physical therapy or PT, a lot of different conditions have shown a lot of evidence that, things get better with PT, from low back pain to hip and knee arthritis or even to fibromyalgia.
So when should patients choose physical therapy instead of medicational intervention?
Yeah, that's a great question. Usually if the risk of opioid use outweigh the rewards, and, so when you think about kind of what we just said with side effects of opioids, are those side effects like depression, overdose, and addiction, withdrawal, are those, not those higher risks not kind of worth it? You can also if a patient wants to not just mask the pain like an opioid generally does do, again, therapists can treat that pain through movement, and you partner with your therapist to really truly work on improving and maintaining your mobility and your quality of life. And generally, anytime an opioid is prescribed for pain, they're most likely your physician is now going to try to give you the lowest effective dose, and often they're going to want that combined with a non-opioid therapy, such as physical therapy. And lastly, usually if you have what we would consider chronic pain or pain more than 90 days, and you've been continuing use of opioids, that risk for continued opioid use even increases. And that's really an opportunity for you to talk to your physician about possibly getting in to see a physical therapist to discuss different options for treatment.
We're talking about opioids, but now what about things like anti-inflammatories? We're not putting those in the same category, obviously,
right,
but can they do physical therapy and still be on such things as anti-inflammatories, whatever that might be, NSAIDs?
Sure. Yeah, absolutely. Mm-hmm. Oftentimes there's even combined. The goal is always obviously to try to reduce your medication need and use, mobility and motion to try to improve your overall well-being, though.
So what do you think about ice when we're talking about some of the pain, low back pain or hip or knee osteoarthritis or any of those kinds of things? Are you somebody that tells your patients that one way to treat that is to ice, or do you like heat? Which one?
We get this question all the time, I would say. And often, it's going to depend on which physical therapist you happen to talk to for that day. I tend to lean a little bit more on ice, as I find ice to be a natural analgesic or a natural pain reliever. Not only can it help with inflammation, but it can help with just, even muscle spasms like heat would, because it numbs the nerves that go to that area, and you decrease the sensation, therefore. So I tend to be more of an ice recommender, so to speak. Heat I tend to recommend, though, for people that have arthritis or stiffness with movement, more that ache as well. But you definitely could use both. Both may work. And sometimes I'll recommend ice, and somebody may come back and say, "I didn't do anything for me." And so try heat, and maybe that's just going to help them better. So it is somewhat variable between person to person for the most part.
And so also when we're talking about different ways that people can help their own pain alongside their physical therapy, what about topical analgesics? Are there any that you use, Emily, that you would recommend, or that you would say, you know what, sometimes Bengay kinds of things do work?
Sure. I will say what we tend to use in our clinic, and that most of our patients do have fairly good outcomes from. We use BioFreeze, which is topical, as well as Sombra. It's mainly more of a cool feeling and versus a warm feeling. Also patient preference on that as well. And you got to remember, though, that is just topical related, so it's not necessarily going to cure something. But it may help, reduce pain for certain activity, or reduce pain enough so you can get a good night's sleep.
So then there's also things like that are more systemic, like fibromyalgia. And people are on a lot of these opioids for those systemic pain conditions, polymyalgia, fibromyalgia. So what do you tell them about physical therapy in general? Because it seems to a lot of people, when they hear physical therapy, that's because they've got tendonitis in their shoulder or they've got some problem with their back. But when they're thinking systemically and something that affects many different parts, what do you do with them, and what do you tell them?
Sure. Well, with regards to physical therapy, we can manage pain a lot of different ways. And with regards to exercise, just general exercise can actually help, even with those chronic pain issues. They have found that in some research that people that exercise 3 times per week had chronic widespread pain was about 28% less common. So just that statistic alone can really show that exercise can generally make you feel better. Also with physical therapy, we do things such as manual therapy. This is kind of more of that hands-on approach of treating pain. So PTs can use manipulation, joint and soft tissue mobilizations, or even dry needling, where we do have some specialists in that field. And they've also even shown some benefits of just simple education and learning a little bit more about pain and what it is and how it works. Just knowing about your pain and understanding your pain history really helps patients that have chronic issues, like with fibromyalgia, set realistic expectations about their treatment, and then can kind of see those successes through time.
And pain is certainly so subjective, because each person feels it in a different way. Now, the Surgeon General sent a letter to every physician in the country recently asking for their help to solve this problem. So the American Physical Therapy Association has launched a national public awareness campaign. Tell us just a little bit about what you physical therapists want the country to know about how you can help manage chronic pain, and why they should come to Stoughton Hospital for their care.
Yeah. So like I kind of said, physical therapy does treat pain through movement and helping you improve your strength, flexibility, and motion. With regards to, tips to avoiding chronic pain, and what physical therapy at Stoughton can help you with is they can keep you moving, can keep you moving gradually and steadily, living an active, healthy lifestyle. They can also really get you into a teamwork-based relationship with your physical therapist, where you can kind of actively participate in your own recovery, and which can ultimately impact your successes. We also like to educate people about not focusing on imaging like MRIs and such. There's been a lot of studies out there, where they've looked at folks that have no symptoms of low back pain and found more than 90% of them had a disc bulge or something, but none of them have symptoms. And to really, discuss with your physical therapist to help guide you back into that active lifestyle you may prefer. And then also to help you address any depression or anxiety. They've also shown a lot of relationships between pain and experiencing depression and anxiety. And, the physical therapist can actually help kind of move you in the right direction to kind of getting the right help for those things too.
Thank you so much, Emily. What great information, and so important for the listeners to hear. You're listening to Stoughton Hospital Health Talk, and for more information, you can go to stoughtonhospital.com. That's stoughtonhospital.com. This is Melanie Cole. Thanks so much for listening.